Let's talk about BiEst. What does BiEst mean? Bi meaning two, est meaning estrogen. So two different estrogens, estriol and estradiol. Estriol is also known as E3. Estradiol is also known as E2. What is the importance of each? So estradiol is the one commonly associated when we just talk about estrogens. We associate estradiol with estrogens. Estradiol will help for hot flashes. It will help decrease bone loss. It will help for vaginal dryness, and it does increase stimulation of uterine tissue, so it will thicken the endometrium. It also does the same thing with the breast tissue, so it can cause fibrocystic breast. Why do I talk about that? I talk about that because estriol, E3, which is commonly forgotten about, is a weaker estrogen than estradiol. It has 80 times less affinity for the estrogen receptor than estradiol, which means it doesn't bind as hard to it. Estradiol causes the proliferation of the uterine tissue and causes proliferation of breast tissue. When it does that, it can increase the incidence of uterine cancer and of breast cancer. Estriol binds weakly to the estrogen receptor to help prevent that problem. Now, what also can estriol be used for? Estriol is very specific for the urogenital area. So for bladder and for vaginal area, estriol is very, very important. It can work for vaginal atrophy. It can help for urinary incontinence. We've had a video about that when we talked about estriol cream specifically. I believe that our bodies make up estriol for a reason. So I believe even though most people's symptoms can be cured with estradiol, or even the long-term benefits of estradiol like bone health and cardiac health, I believe that estriol needs to go along with estradiol to prevent any kind of side effects. That's why at Moses Lake Professional Pharmacy, we recommend prescribing BiEst, so the two estrogens instead of just estradiol. BiEst is available because we are a compounding pharmacy. We can compound it in a cream form and we can compound it in a capsule form. The benefit of the cream form is it can be used vaginally, which will help more for vaginal atrophy and urogenital symptoms like urinary incontinence, and help to prevent urinary tract infections. Orally, it will do the same somewhat, but not always. Some women still need to use some kind of topical estrogen to get rid of those symptoms. Not only does it work locally, but it is absorbed into the systemic body. So you will get the benefits of estrogen like decreased bone loss, like decreased hot flashes, decreased cardiovascular risk, all the benefits of the estrogen. We recommend BiEst, and we also make it in an oral capsule form. So the dosing is a little bit different. You can always call our pharmacy 509-764-2314 to find out more information, or go to www.mlrx.com to find out more. Thank you for listening.